back. This morning we're joined by Dr. Ben Emery from Aspen Ridge Dental. Thanks so much for coming in.
Thank you for having me.
Emery from Aspen Ridge. That's a little difficult for me to say this morning.
Especially in the morning.
Absolutely. All right, so what are we talking about today?
So I was speaking with one of my friends, Tasha, and she said, you know what, something that I'm unfamiliar with, the dental topic, is root canals.
Right.
Why do I need a root canal? Why does the dentist say you need a root canal on a tooth that doesn't even hurt sometimes? You know, or maybe I've broken a tooth and it needs a root canal for whatever reason. Can't you just put a filling in it? Well, there's lots of different indications for needing a root canal. And I think one of the most common misunderstandings is if your tooth hurts, you need a root canal. If it doesn't hurt, you don't need a root canal. If you don't have an abscess or an infection, you don't need a root canal. But the thing is, sometimes you need a root canal even though it doesn't hurt, because the decay is so large and profound that you need to access the inside of the tooth, the nerve, to remove that space to complete a root canal to make the tooth healthier.
So you're telling me I could need a root canal right now and not even know it?
You can do one right here if you want.
Man, sounds painful. So now, as we were talking about earlier, there is a misconception also about the pain level. I know when I was a kid, it was a horror story to go get a root canal, and I'm sure there's been advances in how root canals are done. Tell us a little bit about the pain level. Are they as painful as everybody thinks they are?
Yeah, no, not anymore. Back in the day, they used to take about 2 appointments to get them done. Anesthetic was a little different, the techniques in that, so it was a little more painful. Nowadays, it's done in 1 appointment usually, and it shouldn't be painful at all because the anesthetic that we use is sufficient enough to deaden the tooth completely. And if you're having discomfort during the root canal, you need to let your dentist know so that he can give you some more anesthetic.
Okay, now we have some pictures here. Show us exactly what's going to happen.
So here's a cavity, for example, this dark area, which has infiltrated the nerve space inside the tooth and has created an abscess and infection. Okay. And sometimes this doesn't hurt, sometimes it does. And so you can see the abscess pushing out here. And on the next slide, what I'd like to show is how we remove the inside of the nerve. We use these very specialized files that go down to the very tip of the tooth and remove the inside of the tooth. So we leave the roots in the jawbone, but we remove just the inside. And after everything's cleaned and disinfected, we replace it with this pink material. It's a biocompatible material. And so that way we can fix the tooth, the abscess and the infection goes away. After that, a crown is needed because once the blood supply is gone from the tooth, it can become brittle, and so a crown is needed to hold it together so it doesn't break apart. Okay. For example, if the dentist shows you, all right, this is your tooth, here's the decay, it may need a root canal, even though it doesn't hurt, it may go into this pulp space. Right. So what we find is, in fact, on the next slide, it does need a root canal, and how it looks on here are files going into the tooth, and we take these x-rays just to confirm the length of the files, the specialized files that we use. And so at the very end, what we do, once we have this, we fill it with that material all the way to the very tip so that it completes the root canal. And this is what it looks like when it's done, when you're looking at the x-ray and reviewing it with the dentist. So if the patient has any concerns or questions, you can ask the dentist, does it look good? How did it go? You know, and he should be able to show you exactly how it went and how it looks.
Now, is this something that they'll ever have to come back and have worked on again? Do they come apart later in life, or do they ever have to be adjusted?
The root canal itself shouldn't have to be adjusted unless the infection persists at the tip of the tooth. If it does persist, then you may have to go back in and retreat it, redo it, or do what's called an apicoectomy. It's a surgical procedure to remove the very tip of the tooth and then to backfill it.
Well, thanks so much for coming in and sharing all that information with us. And up next, meteorologist Joe Hansel will have another check of your weather forecast.